Intra-aortic balloon pump therapy. Heart pumps oxygenated blood and nutrients to all parts of the body through the arteries. When the heart contracts, it sends blood out to the body. As it relaxes, blood flows into the coronary arteries to bring oxygen to the heart. An IABP allows blood to flow more easily into your coronary arteries. It also helps your heart pump more blood with each contraction. The intra-aortic balloon pump is a mechanical device that increases myocardial oxygen perfusion and indirectly increases cardiac output. IABP therapy is used to treat cardiogenic shock. Cardiogenic shock occurs when your heart can't pump enough blood to meet the needs of your body. Some heart problems like unstable angina, heart attack, abnormal heart rhythms, heart failure, and heart defects can cause cardiogenic shock. Cardiogenic shock may also occur during certain medical procedure like percutaneous coronary intervention. IABP therapy can be very helpful and sometimes it can be life-saving. But it does have some risks. The procedure may reduce blood flow to your limb and injure an artery. Also, there is a chance for rupture of the balloon which is used. Incorrect position of the balloon may cause injury to the kidneys or other problems. The procedure may cause excess bleeding if the patient has a low platelet count. Strict aseptic technique has to be followed during the procedure, otherwise there is always a risk for infection. Rarely the procedure may lead to stroke in some patients. Risks depend on age and any other medical conditions the patient may have. For example, a lack of blood flow to leg may be more likely if you have peripheral vascular disease. The IABP has two parts. 1. A large bore catheter with a long sausage-shaped balloon at the distal tip. 2. A console containing a pump that inflates the balloon. The balloon is designed to sit in the proximal descending aorta. It comes in various lengths according to body height, with balloon volumes of about 30 to 50 ml. The balloon is usually filled with helium gas, and when inflated should fill up 80 to 90% of the aortic diameter. The IABP works by inflating and deflating at different phases of the cardiac cycle. Balloon inflation augments diastolic blood pressure. Balloon deflation decreases after load during systole. Before procedure, all concerns of patient need to be answered. Also, let healthcare worker know if patient have any other medical conditions. It is also very important to find out if the patient have a problem with sedation. Before procedure, assess for any new symptoms, such as a sudden fever. Ask patient to stop smoking before your procedure. It will help reducing chance of complications. It is also very important to keep patient in NBM from midnight before the day of your procedure. Before and during the treatment, patient probably need to take medicine to help prevent blood clots. Basic blood tests, an electrocardiogram, a chest X-ray and an echocardiogram are to be conducted to assess health of patient beforehand. IABPs are usually inserted via the femoral artery so that the tip of the catheter is advanced into the aorta. Fluoroscopy is not essential for insertion, so an IABP can be placed emergently. IABPs must be appropriately positioned. The balloon tip is positioned just distal to the origin of the left subclavian artery, and the entire balloon should lie above the renal arteries. IABP procedure may be contraindicated in various conditions like severe aortic regurgitation, abdominal, aortic, or thoracic aneurysm, severe peripheral vascular disease, uncontrolled bleeding disorders and uncontrolled sepsis. Complications of the procedure may be limb and visceral ischemia, spinal cord ischemia, renal ischemia, vascular laceration necessitating surgical repair, major hemorrhage from arterial dissection, cerebrovascular accident, sepsis, which is uncommon unless counterpulsation continues for more than 7 days. Balloon rupture is an uncommon event, and is generally related to the balloon pumping against a calcified plaque. Nursing interventions for a patient with intra-aortic balloon pump therapy are performing physical assessment, educating patient on not being able to bend leg with IAB, special attention to record groin bleeding, peripheral perfusion, color, bilateral pulses, temperature, Capillary return, movement and sensation. Maintain circulation observation chart every hour. Any evidence of ischemia needs to be immediately communicated to the cardiothoracic surgical team. Pressure area care is provided every 2 to 4 hourly. Hourly hemodynamic observations. Patient is nursed supine and 30 to 45 degrees head up. Daily chest X-ray to ensure correct placement of IABP and ensure that it has not migrated. Daily pathology for electrolytes, coagulation, urea, creatinine. Daily ECG and more frequently as indicated by patient's clinical status. Monitor IABP tubing for blood. If blood present, inform doctor and immediately and stop pump. Careful monitoring of renal function. The balloon sits above the bifurcation of the renal arteries. Backward migration may compromise blood flow to the kidneys. Check IAB site regularly for signs of infection and change occlusive clear dressing. Thank you. Intra-aortic balloon.